Hi guys, karibuni kwenye show. I'm your host Chep.
And I'm your host Juliet.
And today kwenye show tutakuwa tunaongelea what you need to do as a parent in case mtoi ameanguka aumie kwa kichwa. As we talk, Anaya kona nundu hapa pale. Na hiyo ili happen tu na nilikuwa hapo ika happen. Of course nilimrabia kidogo.
Yeah.
But
unajua watoi huanguka tu. Anaweza tu kuwa anatembea kwa ground anaanguka, amekalia mahali anaanguka. So tuko na Dr. Imran atakuwa anatuelezea the best way to maintain the safety of the baby to avoid causing more harm, kwa sababu huyu mtoto tayari ameshaumia na tunataka tumpeleke hospitali ndio tujue the best way ama the best way forward, tujue ameumia wapi so that tujue the best medication ama treatment ya kupewa kwa mtoi kama huyu. So guys, this is Malezi Bora, karibuni and keep the conversation going. Hi guys, yes, karibuni kwenye show Malezi Bora, and today tunaongea kuhusu kitu who happen sana pale nyumbani, watoi kuanguka. Yani mtoi anaanguka tu either from height and ama anaanguka tu, you know what I mean. So tuko na Dr. Imran kutoka Gertrude's Hospital, and we appreciate Gertrude's Hospital for the support kwenye Malezi Bora, and atakuwa na tuambia the signs to look out for, when to seek for medical attention, because at the end of the day venye tumekuwa tukilan kwa hizo shows zingine, most of us panic, unashindwa kufanya the correct first aid. So leo kwenye show tukue ready kulan. So karibuni, and I'm also joined by Chep. Chep, how are you? Uko poa? Wow.
Good to be here.
Good to see you.
Thank you.
And we appreciate you for the support so far.
Most welcome.
We appreciate you always being there to get back to them and helping us all learn.
Happy to help. Yes.
So Daktari, hii issue ya watoi kuanguka, it's very common, and I'm sure Chep pia wewe ume experience. So watoi huanguka tu, like anatembea kwa floor, anaanguka, amekalia kiti, anaanguka, and they just fall. So Daktari, we want to know, like, easy falls. Yes, we tend to say it's normal, but I want to hear from a doctor's perspective all about this.
So thank you for that. Thanks for hosting the program. Yes, you're right. Head injury is very common in our houses, outside, when children are playing in the playground, or even from buildings actually, which, for example, balconies, which are not really structured very well and gives them access to, play and fall from heights. Okay, especially those who are not supervised as well. Okay, so they are prone to head injury. The other thing that is also a problem is that children are maybe very active and very playful, and they don't look before they leap, or they're not seeing obstacles on their way, or they are distracted. The other thing is that the way the babies or child is that their heads are bigger compared in proportion to their body. So that head is more proportionally bigger, making them more prone to injury to that part of the body. Are we together? Yeah. So if you look at even the heights where they hit, for example, they hit stools or tables, they're exactly at that height. Okay, so making them prone to getting cuts or bruises or injuries on that part of the head. Yeah.
And kitu moja funny, I find it funny. Yani watoi, they always wanakimbia tu, ever running, always on the move.
That's right.
Si eti kuna kazi wanafanya lakini wanakimbianga tu.
Nilishika nani nikwambia tu, I miss the day you were baby. Nilikuwa nakuweka hapo na ngoja hata utana ama mimi nakuja kukutana. But say much anaingia chini. And funny thing, I don't know if do they wanasikia uchungu?
Yeah,
Bete kuna mtu aliniambia ati mtoi akiwa mdogo anguke ati hawezi umia, hasikii uchungu. For instance, anaingia chini ya bed. Unajua ile unasikia tu kudu, like anagonga tu kichwa, but yako sawa, hali anything. In my head nikajambia maybe hata hasikii uchungu. Do they have that sense?
No, definitely, because they'll definitely cry. Some don't cry, but there is some pain. Some may not be able to express the pain. Some may not be able to explain how that incident happened. You see, So it's for us to know that yes, it could be a painful experience, okay, but also just have caution. So for example, we have a lot of babies who are rolling at the age of around 7 months or so. Yeah, they start learning how to roll. So they started sitting, but now they start learning how to roll. So you need to be cautious to make sure that the cots and all that are supervised and sort of padded up so that they don't have that risk of fall. For bigger children, you need to make sure that even the tables are kept plastered or something so that the edges are not sharp, so that they are prone to those sort of head injuries. Okay, balconies and any heights, they need to be supervised or just be off limits from balconies. Okay.
Na napenda kupanda pia kwa height sana. I don't know.
Absolutely, yes.
I don't know.
It's sort of curiosity and learning to grow, as we all did,
Yeah. Because at the end of the day, you try to let them know like it's not good.
Yes.
It can cause you harm.
That's right.
But the next minute utampata tu pale. And again, so daktari, when we talk of mtoto ameumia kichwa, at the end of the day, most sisi kama wazazi, mtoto anaweza tu anguka, labda hajalia, na we tend to assume hakuna kitu ime happen because you know when something big happens una expect huyo mtoto alie but unapata huyo mtoto hata hajalia. So what are those things one should look out for ndio ujue hapa kuna shida?
Very good question, because that depends also on the amount of injury. Okay, you could have a small bump and then you have a swelling, a localized swelling, but the child is active and playful and forgets that he got hit. But you as a parent, you're always looking at that bump. Okay, sometimes the bump can be, discolored. You may have it going different color from the normal color. So that tells you the impact was a bit stronger. Because you see the scalp is very thin, so you can get bleeding. Okay, so if it's an open wound, it can bleed severely. Okay, and then you know how to manage that one. But it sometimes may just be a blunt injury, so it's not broken. The skin integrity is not broken. So you have now a swelling. But if it's discolored, you can know that the injury was so severe that there was bleeding under the skin, and that forms like a bruise. Yeah, and that sometimes takes its own course and it resolves with time. All right, but then it could be so severe that you can actually lose consciousness. Okay, so a child can actually hit himself or fall from a height, and the impact is so severe that the brain undergoes some form of what we call a concussion, a shake, an injury that can result in the child losing consciousness, be it brief or long. That is significant. Okay, yeah. Now, other signs to look out for a child who has fallen, for example, and or has hurt his head in any way. We talked about bumping or falling from a height, be it small or big, is that they can be suddenly vomiting. Okay, this sudden vomit may be once or twice or thrice. Okay, as the brain is trying to come back to stability, there can be some form of vomiting because of balance and other things. So that's a very important sign. We usually look out for vomiting. So I'm looking at the really sinister things, and then we go down to the normal things. So vomiting is one very important sign to look out for severe head injury. The other one is fits or seizures or convulsions. Okay, if a child falls and after a few minutes or hours the child has an abnormal behavior where he either stiffens or eyes roll or prods, that could be a very severe head injury that needs to be checked. Okay, so that's the second one. The third one is sort of drowsiness. Child has been okay, he fed well in the morning, but unfortunately the incident happened, and then you see that the child is just too sleepy or too drowsy or not able to be woken up after he's asleep, like you say. So there's that. So that could be something that's ongoing, because remember, head injury, you may have the first primary injury and then there's secondary injury. That means that there's that initial blow. Then what comes after can take several hours and can be at a worse impact on the child's life than what just happened initially. So to prevent brain injury going from primary to secondary, you need to consult the doctor or the emergency care early, so that they're able to evaluate based on those symptoms. Okay? Are we together? Yes. So we've talked about vomiting, we've talked about seizures, we've talked about altered consciousness and drowsiness. Okay? Yeah. And of course, weakness. Now remember, a child's brain controls everything, movement, this. So if a child is limp or they're not able to move their hands and their legs, we call that paralysis in a way, that could be the worst sort of form of now, head injury, that it's actually affected the brain so much that they are not able to do the normal movement functions.
And Doc, you can probably show us what happens, for example, when a baby falls from a high place to a low place. I mean, what is this baby for today?
Oh, right. So today we have this demonstration for everybody, whoever's viewing. So we will look at an example of the worst case scenario where we have a child who has fallen. Okay. Now, in my experience, we have a lot of these. Let's say a road accident. A child is hit by a car, okay, and falls on their head first, or whichever way. But you know that because of that injury and the extent of that injury, that this child has probably a primary brain injury and there's probably a neck injury as well. Are we together?
Yes.
So any of those, because remember the nerves, the brain controls everything, movement and function, but the nerves are the conducts, go through the neck. So if this injury to the neck, this can actually lead to paralysis all the way down, isn't it? So what we've demonstrated this child today is to prevent, as you transport safely to the hospital as an emergency care, because there's always safety first. We always talk about safety first. So let's say they've just fallen. You need to make sure the environment is safe for you and the child, that you're not at a hazard to get either, let's say, electrocuted or a fire or something. You must make sure that you're all safe, okay?
Yeah.
You must shout for help. You can't do these things yourself. Wherever you are, if you're the house help or the nanny, you need to ask the neighbors or someone to come and help, but not to panic. As we always say, we do not panic,
Our
okay?
hashtag, yeah?
Our hashtag,
Do not panic.
yes. Yes, and then make sure that you're in a safe environment, as we talked about, and you yourself, you're safe. You're not at risk of getting, blood or anything on your hands or something. So gloves or something, whatever you have is able, so you can do that. So the next thing is to stabilize the neck wherever you are, so that when you're transporting safely, you're not causing more injury to this child. Because I've seen that in my experience, a lot of children, let's say, who have had a car accident nearby, they just brought the child being held in a manner that could worsen the injury that is already sustained in the neck, and this could actually be the defining point of paralysis to this child. But if we can protect that child wherever we are, outside, inside, or in a health facility, then we are here to inform you about that. So today we're going to demonstrate how to stabilize the neck. So let's say a child has fallen after a car accident and this child is now lying on the road. So yours is to make sure you look for something that can make sure that the head does not move. That is the principle about this, okay? So you can use many things around you, okay? So for example, if you're in the house, you can use like unga bags, okay? Like bags of flour, okay? And you can put them on the side of the child's head. That way you restrict the movement of the head, because he might be in pain and he may be turning and may be uncomfortable. But just restricting that can actually save this child's, life in terms of walking, quality of life and everything in the future. So you want to make sure you preserve that. So if you don't have the unga, you can actually improvise and use cotton sheets like this one. You can hold that one for me. And this is one I have made myself. Okay. So you can see that I've rolled it up. Okay. So you can just make a quick roll, and using just simple masking tape, you can actually make what we call a, so we just do that. And you can hold that for me. Okay. So we're going to just sort of wrap that up a bit. Okay. So now you have something to stabilize that head. Okay. Try that one. Can you close this for me?
Yes.
Let's do that a bit. There we are. So as simple as that. Now what we have are two little head blocks. Okay. So if the child was sitting this way, if they were smaller at least, you would put them on the side. All right. Now you can't be holding this all the time, so you may want to, if it's a firm stable surface, you may be able to put this in place. So for example, I'll get you guys out of your seats for a few. Maybe you can come and volunteer. So you basically hold, so what you'll do is hold the head in one position. Okay, so you can come and do that for me. That's what I've done. So basically hold, no, so you don't touch the eye, so you're just holding that and sort of holding the shoulder, and you're putting yourself, you can even lean down and hold so that you are not moving, you see. So the child not able to move, you've kept that firm. You've put your blocks on the side of the head, so this child cannot move the head and neck as well. So then your other help can take another masking tape, okay, and you can actually put one over here. So I'll tell you to move your hand slowly. Remove this hand as you try and see if you can hold, and we hold onto the surface. Okay, so this one then continues onto that side. Keep holding the head, continue that, and you can put it onto a firm surface. Okay, now you see that?
Wow.
Yeah.
Child is not able to move their head. Okay.
Wow.
Remember, the ambulance is on their way, so you need safe transport for this child. You cannot carry this child that way. You can also repeat another masking tape on the chin as well, just for reinforcement. Okay.
Okay.
So this way, the child's head is not moved around carelessly, and we've stabilized the head. Then you can use this surface, whatever it was, it has to be a firm surface to move this child safely to the hospital or in the ambulance, and then move them directly. Or the ambulance can then improvise, because they usually have stretchers which can quickly move stably into another stretcher to be able to move easily. Once they reach the hospital, we are now more happy and content that this child's neck is safe. It has not has had more injury. Then we can go safely to the radiology department and do an CT scan to make sure that the head and the brain and everything is intact. Once the neck is stable, then we can be relaxed to remove all of this setup that we've done. Okay? Therefore, we have saved this child from paralysis and more injury, and the child is not in, all of those sort of complications. Okay? So this was just a basic setup, because this is what I've seen a lot wherever they come from. Head injuries, and then the child is just brought abruptly. There's no stabilization. So like our ambulance services are not like in Europe, where there's emergency to everyone on demand at any point, you see. But to get the child safely to the hospital, you need to not make more injury. The child is already injured. You don't want to worsen that injury. Okay? Yeah, so ideally a paramedic would be able to do this at scene, but for those standbys who are able to do this and who have learned what we've done, they can use simple props, simple devices, simple things that you look around, and they're firm enough to be able to make sure that the head doesn't move, so that once the child is stabilized, then other first aid can be done. If it's a cut, they can sort of put pressure on it as they get to a healthcare facility.
And the other question I would ask is, for example, a baby falls and they have a dent on the head. That dent is painless, but the dent is still there. Will it be a permanent mark, or is there a way you can do for it to move, to go away, to disappear?
All right. So in your example, is this child stable and playing active like normal?
Yes.
So then that was more of a cosmetic problem or aesthetic problem, because the child has no injury, they don't show symptoms of head injury. They're playful, they're doing the normal behaviors and acts that they normally do for a child. They're not having, like, for example, convulsions or altered consciousness. So you feel that they are okay, but because of the scar or the injury, then that usually you see maybe a plastic surgeon or someone to correct it for aesthetic value only, but not primarily for anything else. Okay?
And how should one handle, for example, a fall where a child, okay, let me just say an experience I went through with my second baby. So the DM was feeding porridge. So walikuwa wamekaa kwa veranda tu, mahali kuna mahali tu pameinuka juu. You see those windows that hazina grills?
Right.
So you uko ile side, kuna hiyo open space. So amekalia hapo na anaweza tu geuka anguke the other side. So that's what happened. Alikuwa anampatia uji, and suddenly mtoto akaroll the other side. Sio yenye msichana yuko the other side. Right. So you see now, kabla hata atoke his side, azunguke ndio ende kuchukua. You see? So luckily kulikuwa somebody had visited me, I wasn't there. Kulikuwa na mtu alikuwa amevisit, so alikuwa hiyo side yenye mtoto alianguka. So immediately alichukua tu mtoto mbio akamwelea hapa. So nao na mimi penye nilikuwa nikasikia mtoto amelia, so nikakimbia kuangalia. So ninapata DM ako tu hapo analia hivi ana scream because now ameshtuka. So I think it's also important for people, not even moms, hata watu wa anyone to learn on these first aid things kwa sababu for example kama huyo kijana mwenye alikuwa amekuja angechukua tu huyo mtoto, angejua the right way of how to handle the baby. Pia DM angekuwa na ile knowledge ya I should not panic, mtoto ameanguka, I should run, niende nimchukue na nafaa kumshika hivi. So eventually nikachukua mtoto. Pia mimi nikumbuka sijui mtoto hajaianguka nikiwa, so sijui nianzie wapi. Sijui ama amegongwa mguu, sijui ama ni mkono, sijui kichwa. So mimi kidogo knowledge yenye niko nayo, nianza tu kuguza kila mahali, nafinya kila mahali ndio nione ni wapi nitaguza alie. So you see, I'm doing that out of I'm panicking, I'm crying. By then at that moment I was crying because sasa sikujui mtoto ameumia wapi.
And how was the baby? Alikuwa
tu sawa, lakini alikuwa ameturn red like ile
like shocked, eh?
Yeah, alikuwa ameturn red and then ukimwangalia tu machozi imejaa kwa uso cause analia. So nikanaguza mguu, hakuna shida. So nikakuja huku kwa mkono, nikiguza hapa analia. Nikiguza hapa analia. So nikajua hapa kuna shida. But sasa I didn't know what to do. Nilikuwa nakwambia ile knowledge yenye tunakuanga nao pale nyumbani. It's on another level. I think nilikuwa kuna dawa zingine zinakuanga za kusugua ukiwa na pain nini. So mimi nikakimbia nikachukua nikasugua mto. You know, me I'm thinking I'm doing first aid. You know, as a mother.
Yes, your sixth sense plays in, you know. Yeah. And you do whatever best you can do.
Yes. So me nika apply. But now something else told me, Juliet, what have you done? I don't know what is inside, what is happening inside. Yeah. Of course, I can see the baby is crying and there is something like it's swelling. But what about the inside? So I just decided, let me call a cab. Tuende hospitali, tukaenda hospitali. Mi venye niliona x-ray, I cried because even the doctor hakuwa na like the doctors they don't show you they are shocked. Lazima akuwe anakupea hope. So ako tu sawa. Mimi niliona x-ray, mtoto amevunjika, wrist imevunjika. And it's just something yenye ninge assume, unaona. So that was it. It was a branch hospital, actually Gertrude's inaitwaje pale Mombasa Road.
Embakasi.
Yes. So tukaitiwa ambulance, ndio mtoto sasa aletwe hapa. Tukakuja na tukaadmitiwa hapa. So when I tried to think of such, it was a fall. But as a parent, I didn't know what to do. Nitajua ni wapi amegongwa. Labda daktari unaweza tu enlighten tujue in such a case, labda mtoto ameanguka tu, you are not there. Utajuaje other than the head, utajuaje ni wapi shida imetokea?
Right. So that's a good question, yeah? So when we look at the injury itself, we look at the environment where it's happened. Is it from height? Is it in a bush or something like that? Is it in a rough area? And that will also tell you the extent of the child's normal behavior, will tell you how severe that injury was. Like we've talked about the bump, right? Yeah, so it could be mild, severe, and then if it's changing the way they behave, you can know this is not normal. Like the way the hand was painful.
Yeah.
Like I said, children are not able to really express themselves. Some of them are not able to talk. So you as a mother need to get to know where is the problem. As a parent, where is this problem? All right? So I think you did really well because as much as you stabilize the head, you need to look at the normal functions that can, worsen life. So one is your airway. So if a child is having something in the mouth or something that's not making them able to breathe, that's the first place you need to check is in the mouth. Is there anything that can alter this child not to breathe? Okay? So if the child is screaming and shouting, that the airway is clear. That way you don't have to worry. You can see this child is able to breathe. Then you also look at the chest and you see, is the child breathing well? Are they breathing normally? Is there something abnormal with the breathing? In your circulation, you look at things like, are they bleeding from anywhere? You just look over the skin, you expose, make sure you expose because you don't miss out on things. exposed everywhere. In fact, undress completely just to confirm that there's not an injury that you've missed out. Then as long as there's no bleeding, then now you're able to do what you did very well, is to check the limbs and the hands and the legs to see for any swellings, cuts, bruises, deformities, any loss of function. So for example, she was in pain, you know, she was crying more when one limb compared to the other was. So you can even compare both left and right, are they looking the same, and you know, those sort of things. And then you're able to then say, okay, Daktari, you know, when I saw this, this is what happened. So they're also able to, you know, direct their thoughts to maybe another injury that was out of their mind when they're looking or inspecting the child. Okay, so yeah.
Interesting. I think even this, me, I was a student. I was a student. Anayeanguka sana, sija experience anything severe, but what I learned from my dad is yeye uniambia mtu yeye akianguka mpeleke hosi regardless. Ila hata kwa bed kuroll akianguka chini mpeleke hosi angaliwe na doc just in case.
You'd rather be reassured that the child is okay rather than assuming.
And the fact that they don't communicate, hataweza kukwambia ni hapa kunauma, ni hapa kunauma. So actually as a parent, what you're doing is guesswork to try to know where the kwenye shida iko.
And just another important question I wanted to ask was, do babies get headaches? Do they have headaches?
Yes, they could have headaches. You can't know until they speak and tell you about it. So only a 3-year-old, probably a 3-year-old is able to express themselves better and tell you, mommy, tumbo, mommy, head, because they're able to then point to where they feel the pain, you see. Before that, it's very difficult to actually know.
Because actually my first daughter, there is a time she was telling me, Mom, naumwa na kichwa. I'm like, okay, kichwa ni ya watu wakubwa, mtoto mdogo anaumwa aje na kichwa.
But if it persists, because you see, the children don't lie as well. They don't pretend or assume. So it's good when they repeat that symptom. It's always good to bring it out with the doctor and say, look, she's repeatedly said this and this and this and this and that. Okay. Yeah. The other thing that I need to emphasize is bathing your child. When you should take it on yourselves to bathe your child. Don't give that to someone else, because that's the only way you'll actually find bruises, cuts, bumps, and rashes, and you're like, oh, I didn't see this. And you can't assume that she's okay if you don't have the time to bathe her. It's a very intimate thing for any human being, is the bathing time. So let's encourage ourselves as parents, as guardians, to do that. Take time out, bathe your child. That's the only way you're able to actually note some of these changes in the skin or integrity and all of that, and then question, because that's where a lot of things come out. Like, I didn't see this, where did this happen? I didn't see this injury, how did it happen? You see, because a lot of, unfortunately, people hide things and then we don't know until we know, and that's worse. You see, when already the injury has already taken place.
Actually, I like doing that, and with my first daughter, ni msichana, yes, lakini zile dent anakuanga nazo. Sasa unajuanga ukimuosha unasikia ukiguza
so then you can then
sasa alianguka akagongwa kwa magoti. Sasa wewe unajua unaosha tu. Sasa hapo ndio utajua. Mpaka najiuliza, huyu ni msichana niko naye ama ni kijana. Unajua, okay, many people wana associate madents kama hizo na vijana, kwa vijana of course ni watu wa playful, vitu kama hizo, but these are girl, but zile dents anako. So whatever you're saying, it's true. I like doing that, by the way. Kuwaosha when I'm home ni mimi, so that you can get to see those small dents.
Probably my last question would be, is it always advisable to give the baby paracetamol in case they fall or any dents, they get any dents?
So definitely, I mean, a dent, when you talk about dents, that's like quite a big injury, okay, because there's a deformity. That must be quite painful, okay? So you can do the basic things like paracetamol as well. You can even use cold packs, okay? So you can take like peas, put them in from the freezer in a packet, and then cover them with a cloth so it's not too cold, and then put it on that swelling, okay? So for the minor injuries of the head, you can put them quickly so that the swelling doesn't go to a point where it's actually very noticeable. So you can really keep it that way. But you're right, paracetamol, pain relief is one of the modalities of management in head injury.
Wow. Thank you so much, Daktari.
Most welcome.
We appreciate for the information.
Yes.
Each day is a learning day. Absolutely. We learn a lot, and we are happy that you know, we pass this knowledge to other moms out there, such that we are all in a position to bring up our babies the best way possible. You know, because we say a happy baby, a happy mom, and a happy society.
A happy society. Yes.
So guys, thank you so much. That has been MALEZI BORA, and we appreciate for keeping it here. And I know you've learned one or two or many things. So thank you so much. I have been your host, Juliet. Mom story of the day coming up next. Bye-bye.